Yes. Hi. Thanks, Chris. I guess my screen's coming up here. All right. I guess everybody can see my screen now, so we'll start. But yeah, as Chris said, head athletic trainer, Las Vegas Wranglers. It's a AA hockey. I was previously with the Washington Capitals organization, and also kind of pulling double duty in high schools, public and private. So concussions is something that I've been familiar with. Returning some of our hockey guys, at the professional level the last couple years, and then now on my own, and also at the high school level. Previously before that, I'd been in the collegiate setting. So, I've been around the block, and this is kind of how we implemented concussions in the secondary setting and what we did concussion management-wise, at a small private Catholic high school. Worked rather well, and it's a conglomerate of stuff I picked up in the NFL, NCAA, NHL, and then even in the public school realm. So kind of bridging that over and how we and I guess part of my screen is blocked again. It's this webinar thing. Let me see if I can get rid of that. Is that better? I'll get a text letting me know if that's better or not. But the outline. So we'll go through the outline here of the presentation. I'll give you a brief background on what is a concussion and why is concussion recognition important. We'll go through the myths, as well as how far we've come, where are we now. We'll get into accommodations a little bit briefly towards the end. I know that question came up halfway through last time, but it'll definitely be there. As well as, what is the future? Where are we going from here? A concussion, it's defined as a type of traumatic brain injury caused by a blow, bump, or jolt to the head, neck, or body, which results in a change in the way your body normally functions. That's the direct definition from the Center for Disease Control. So that's kind of a newer definition that came out maybe about I'd say 2 years ago or so, might be 3. But it used to be the definition for concussion used to be a headache and then 1 to 2 related symptoms. So based on that headache, so it used to say, like if you had a headache in the back of your head, where the controlling of the the eyes, your eyes are controlled in the back of your brain in the occiput. So your headache was in the back, and then you had potentials for anything with your eyes, like sensitivity to light, something like that. That was considered, the concussion. So it has changed. So basically, what we're saying is it doesn't have to be being hit in the head. It could be a jolt to the body that jars the brain. So it's the acceleration of the brain. Going on. Sorry, I get like about a ton of emails from players and people all across the league. I just got one, and I also apologize. The formatting for this is a little different on this PowerPoint than the original. So if there's mistakes. Secondly, it is important to note that in the medical community, concussions may be referred to as a mild traumatic brain injury, which is the MTBI. So you see that a lot over the over the years, and I guess over in the literature, concussions referred to that, since they're usually not life-threatening. So the concussions that we're seeing in athletics generally are not life-threatening, especially if there's proper concussion management. So that's kind of the purpose of this, is how to manage them, one, kind of athletically, and then also academically. So we'll switch here. Right here, this is the signs and symptoms of the concussion. So the CDC puts this out. It's really good. I know a lot of people who have made it onto cards to hand out to families when a student, child, athlete has a concussion. Also they made it into magnets. They've put it, given magnets out to the athletes, to put in their lockers. They've given them to parents to kind of hang on the fridge. It is very good. It breaks it down into 4 key areas of a concussion. As you can see, the thinking and remembering, so that's more like your cognitive ability, which this is also what impact measures. So impact measures the left side of this column. As you're looking at, the physical is what they can kind of tell you, right? Really, the only one you could actually see would maybe be vomiting or balance problems. Everything else is kind of self-reported, and same thing over here. Like, you might be able to experience their difficulty concentrating or their difficulty to think something out, but everything else is self-reported. Same thing, like here, the next column is emotional and mood. So it's kind of, the athlete, and this is where knowing the athlete is huge for some of these, because you might notice they're more irritable than usual, or more anxious or nervous or more emotional than usual. But other than that, a lot of times, even if it's a subtle difference, you might not notice it, but they're going to notice it. They can report that to you. So, and then same thing here, the sleeping, that's something, as a parent or, maybe even as an instructor, if students starting to fall asleep in class, and that is very, unlike them, or at home they're sleeping, they're a lot more tired. Those are some things that you may notice, but a lot of stuff is more them, reporting it to you. So, keep that in mind. Importance of early recognition in the education of a concussion is very important. They can be tricky to diagnose and to screen out, but it's important to know when do their symptoms occur. A lot of times they're not at the onset of the incident. They're delayed. So, per example, I gave a scenario of a hockey player we had. About a month ago, 2 months ago, it was on December 8th. One of our players was hit at open ice, full tilt, so he's coming up the ice carrying he just received a pass. Okay, our guy should probably never pass it to him, but the other player is coming at full speed as well and hits him from the other team. His helmet flies off, stick, gloves. I mean, it's a complete yard sale. Stuff's everywhere. I go out there. I get to him, and I ask him if he's okay, and he's like, yeah, I'm just stunned. Like, what happened? I must have got, cleared out. Like, he's like, just let me collect myself. So which is fine. I mean, I understand that. I mean, it's like he was in a car accident. I mean, that's essentially what had happened on the ice, and we skate him over to the bench, and he's okay. We go through initial concussion evaluation. He's fine. And, we get to the locker room. In the second intermission, which was probably about 10 to 15 minutes later, and that's when all of his symptoms started to come into play. So, he couldn't focus on the writing on the board, couldn't focus. The main thing he kept complaining about was he couldn't see your eyes. Like, if you were standing across the room and he looked at your eyes, he couldn't see your eyes, and it freaked him out. And that's where he starts reporting all of his symptoms. Up until that point, if you talked to him, you looked at him, everything was all right. There's no guys coming in saying, hey, so-and-so's jacked up in there. There was none of that, which you usually do see, but everybody, he appeared normal to everybody. And that, going on to that, like, concussions are a team effort. So sometimes you might get as much information out of that athlete as you would a coach, a player, or another player. So, like, a lot of times, like, we'll have players come up, because in pros, like, there's 2 scenarios. They're going to want to play all the time, or they're going to try to use a concussion as something where we can't release them. You can't release an athlete, if they're currently being seen for an injury. So, so they use that to try to stay on the roster. So it's kind of interesting dynamic. But you'll have athletes who'll say, hey, so and so is really jacked up. He's still having symptoms. We sat him out for a game, and he's sitting up in the stands with another player up top. And the goal sirens, are triggering headaches. But the player, if you ask him the same question, he'll never report that to you. So it's a good collective team effort on taking care of these. you always want to take the guesswork out of it. So if you have any inclination that is this or isn't this a concussion, you know, you should probably label it as one. And you know, aside from that, you also want to make sure that it's not a concussion. So you want to exhaust every possible, you know, option. As an athletic trainer, so if there's any athletic trainers on here or athletic directors, you know, your athletic trainer should have a set system that they perform for on-field, and then they should also have a set system they do for off-field assessments. And it needs to be like clockwork. So I'm at the professional hockey athletic trainers meeting last year, and I'm sitting there with everybody, and the only people who had a set system on what to do, it was me and guys from the NHL. Everybody else had like no clue what this guy was talking about, and these were basic principles. And it needs to be concise. So like I'm talking like upper core neurologicals need to be completed within, you know, I can do one in about 45 seconds, a whole upper quarter and cranial nerve assessment. And that's something that should be done, I think, across the field. Off-field assessment is going to be a little bit more thorough, usually going to use the SCAT-3, which will be emailed out to you. That's new. The SCAT-2 is the old one. And then there's the SAC, which is a standard something assessment for concussions. You know, that, you know, it's a little bit less watered down than the SCAT, but the SCAT is kind of the gold standard right now. So the SCAT-3 is the newest. So if you guys are using a SCAT-2 in your school, please move to the SCAT-3, which is also going to be included on the email attachments for this. The other thing is, how does one concussion and one concussion equal 4 concussions? They're synergistic. So it's kind of the new research, and it's been out there before. But you get hit one time, you don't fully recover, you get hit again. It's not like I have a concussion and now I just got a second. It's I had a concussion and now I got this second one, but it's now like I just got 4 right on top of each other. They're compounded. You know, that's why it's important to heal fully from the first one. There is research to show that each consecutive concussion, the symptoms do last a little longer. They could be more severe, but at the same time, like for every case I hear of that, I have a hockey guy who gets one and he's fine within a day. You know, but he had just had one that was, you know, 2 years earlier that he sat, you know, a month for. So I don't completely fully buy into that, but that is, you know, a work in theory right now. Athlete education is important. Rydell, that's a company that makes football helmets. Okay, they come out with a video that talks about, you know, concussions, proper head position and hitting. It's a very good video. Every high school football program should be watching that video on the first day of practice. Just because if you're not watching that video and something happens and it comes out, well, did you watch the Rydell video? No. You need to be covering all aspects here. Always think legal first. NCEA, that's the certifying body that certifies all football helmets. They also do baseball helmets. They don't do softball really because of, you know, the velocities of the ball, but NCEA, you know, these helmets need to be certified by NCEA. If you take it off the shelf, even for the kid plays, the student is out there for one practice, quits the team, that helmet should probably not be worn by anybody else really for the rest of the season, and then should be certified before somebody wears it for the next season. CSA, that's who certifies hockey helmets. A hockey helmet really doesn't get reconditioned. After 1 to 2 years, they're just thrown away. Coaches and administrators, education. All right, there's the National Federation of High School Sports has concussion education online. It's about an hour, not more than that, where you go through slides that kind of educate you on concussions. There's a quiz at the end. If you pass the quiz, you get to print off your certificate on concussion education. I suggest all high school coaches and administrators do that if they're not already doing it. Parent and guardian education. I talked about the magnets, signs and symptoms. You know, preseason coaches meetings. You know, they need to be educated, and when it comes down to the safety of their child, 9 times out of 10 that, you know, they're going to side with the safety of their child, and that's what you need to really gear it down to. There are instances, for say, last year, Westminster, Maryland, the athletic trainer there is at Winters Mill High School. It's like a 2A, 3A public high school in Maryland. the athletic trainer was actually fired for trying to be too conservative, or was relieved of his duties. So things like this do happen, but it's something where the school as a whole needs to be on the same page. Administrators, athletic directors, athletic trainers, coaches, it's a team effort. It really is. And I would always err on the side of caution. Early intervention. Anyone suspected to have a concussion should be removed from play and evaluated. So, if you suspect a guy gets up from a play in football, and he's walking a little woozy, he should be brought over and he should be evaluated. If he passes his evaluation and has no issues even with a minimal exertional testing, which is like push-ups, sit-ups, jumping jacks, maybe some light sprinting on the sidelines, if that doesn't increase any symptoms, or he doesn't have any symptoms, that pop up from doing that, he doesn't report any symptoms, then generally that individual should be allowed to return to activity, at that time. You should also probably keep an eye on that individual because of the potentials for delayed, symptoms. That's why they are trying to move to the high school setting, that if this person gets up and they're woozy after a hit in football, that individual should not return at all for any reason for a 24-hour period. And then if they wind up having concussion symptoms, they should then be entered into your concussion protocol. That's kind of the new standard you're going to start to see, I would say, sweeping the nation over the next year or two, if it's not already in your state. That's the other thing. Most of this stuff is state by state, so you gotta know your state. Just because an athlete says they're fine does not mean they're fine. University of Pittsburgh, UPMC Medical Center, they're the ones who developed Impact. They came out with just because I say I'm fine, I'm not fine. You need to look further into some of these athletes. I never usually leave it with "you're fine." I always ask, how are you feeling? And then if they say fine, I still say, no nausea, no dizziness, no lightheaded, no sensitivity to light. And I go through the concussion checklist in about 20 seconds. And they, no, 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 no. And then I'll do a quick cranial nerve, and probably I'll do some upper quarter, selective upper quarter testing, strength testing real fast, and before I send them back out on the ice. Responsibility does lie on the athletic trainer at the end of the day, so that's where they need the support of everybody else, and that's where I say, like, coaches and athletes should also be held accountable for early notification. So that being said, I would always educate my coaches, always educate parents at that preseason meeting. The athletes are there too, and you talk to them like, one, I don't want the athletes to lie to me. Two, like, I'm going to get you back on the field rather quickly. If you have a concussion, you come to me right away. Usually, you're not going to sit too long, but if you don't, you're going to sit for a while. And you talk to the parents. This is all about their safety. And then you have parents sending you emails. Well, you know what? Johnny came home after the football game. He didn't feel the best. Could you please take a look at him? And that's one right there. That's a scenario that 50% of high school athletic trainers never see, because they may not be bringing this up, or the parent may not be referring it back to the school. And to be honest, the athletic trainer is probably one of the best people to screen someone for a concussion. Their education is very extensive in this. On to myths. All these are false. So we still grade concussions on a scale. That is false. So you hear anybody say, well, it's a grade 3 concussion, or a grade 2, or a grade 5. I said in the earlier one, there were 5 concussion grading scales. The 2 of the main ones were the Colorado Medical Society, and the other one was the Cantu scale. Those are not used anymore, and they shouldn't be. We're learning that every concussion is different. So that one that was like a grade 1 concussion before, that we're finding that individual might have symptoms for up to 2 to 3 months, and before we were saying, oh, well, there was like a minimal grade 1 concussion on some scales, they could return the next day to athletics. We're learning that that's not the best. May still be done, but this should have no bearing, or barring on time of sitting out. So some people will still use it, but should not fall into who should sit and who shouldn't. The only scale that I would use is, I said this earlier, is the Glasgow Coma scale. That takes into account, how they're feeling, their consciousness, their ability to to do certain things, and that's based on their full brain function, and that's what they use for like car accident victims. Some people use it in sports. They use it more in a professional setting where there's doctors around all the time, but that would be the only one. 2 concussions in one season disqualifies an athlete for a year. That's false. You could have a light concussion in the preseason, and sit, for about 10 days, return, be perfectly fine, and later in the year you could have another one, and you sit up another, week to 2 weeks, and you're usually perfectly fine from that. As long as you're fully recovering, there shouldn't really be an issue. There are some states that are trying to limit, if you have 2 or 3 in a year, you're done. That's obviously the best interest of the athlete, but there's probably a reason as to why this athlete's having this many concussions. It could be simply they might not have enough fluid, in the skull cavity. The brain is just sloshing up against the skull. It's not being protected. The athlete's neck might not be strong enough. There's a lot of things. It's only a concussion if you go unconscious. That's false. A lot of doctors still try to use that. That definition hasn't been used since probably about the 80s, and you still have doctors using it. You need to sit 2 weeks without activity. That's false. You just need to sit as long until you're symptom-free for about a 24 to 48-hour period. So if that is 2 weeks, that's 2 weeks. But if it's not, it's not. So each one, the main take-home point of this page is everyone needs to be treated differently based on symptoms. Every concussion with the same symptom set acts the same way. That's false. You need to wake an athlete up every hour when sleeping. That's false. Most you need to do is several times throughout the evening. Maybe go in and just kind of nudge them a little bit. If they respond, roll over. If you say their name and they grunt or whatever in their sleep, that's usually enough to say that everything's okay in there. Concussions are overdiagnosed compared to years ago. I don't believe so. I believe that we have a better understanding of the brain. We have a better understanding of what a concussion is. So that's why you are seeing more. The other thing is sports are more violent. In the 70s, you didn't have kids lifting in weight rooms, like you do today, in structured programs and things like that. The athletes are stronger. They're faster. Collisions are more violent, so you're going to see more concussions with that. So there's also, we'll get into some of the other stuff, some of the other theories as to why there's more. Let's go with how far we come, just so kind of everybody knows. This is 5 years ago when I was working in the collegiate setting. Collegiate football, if signs and symptoms lasted less than 15 minutes, athletes were allowed to return that day. So you came off, you had this is what they used to call the bell ringer. You come over, you have the headache. Oh, you know what? But I'm okay. I'm fine now. I sat for 5 minutes. I feel perfectly fine. Well, here's the thing. They probably feel perfectly fine. As soon as they go back out on the field and they get their heart rate up again, they're not fine. But because they've been cleared, they're under the assumption that they are fine. So that's why now this is a concussion. They're entered into the protocol. If signs and symptoms lasted over 15 minutes but less than an hour, the athlete was sidelined for that day only. Okay, and then they were allowed to return without a return to play before. If symptoms lasted over an hour, athlete was sidelined until symptom-free, and then immediately after they were symptom-free, there was really no other return to play guidelines other than these. So what they were allowed to do is, as soon as they're symptom-free, you could have thrown them back out, in the game. 3 days later you're playing soccer. 3 days later you have a game. You can put that person right back out on the field. So these have all changed. Where are we now? And I guess it's kind of where should we be. It depends on your particular state legislation. So Maryland, Pennsylvania, they're kind of forefront states in concussion management. All right, Pennsylvania is one of the first to have state legislation on this. And then Pennsylvania has come out with some other ones, which I hope we do some presentations on some of the other things, like the sudden cardiac arrest and things, which they're the first state to really go through and do stuff on that as well. But definitely check your state guidelines, because some states, might not have anything, on high school athletes, and others might be very strict, a little bit maybe even more stricter than what we're presenting to you today. But these are good rules of thumb. All right, all athletes participating in contact sports should be baseline tested, whether it's a baseline test on a SCAT test or a SAC test or even an impact. All right. I use impact a lot. I use it in the schools. I used to not be a fan of impact, but kind of as we go, I believe that it is a valuable tool in the return to play process based on the neurocognitive testing that it completes. So if your school is not impact testing your athletes, it would be something I would look to do. It used to be free for 1 year, a 1 year trial free period for high schools, but now I think everybody has to pay regardless. But it's not that expensive. Most small schools can get it done for about $250. The larger schools max probably $750 for the year, and it's an online test. You set them up in the computer labs and you roll. And then it's just another tool. It's a valuable tool, and Impact is not paying me to say that. All right. Any athlete suspected of having a concussion should be removed from competition or athletics immediately. Athletes should be screened using several measures. So, you should be using the SCAT. You should be using a symptom checklist. You should be, maybe doing balance. You should be, and that's where I think the SCAT really is good here, because it measures a lot of different things. It's screening a lot of different aspects for concussion versus somebody just running through just a symptom checklist or just doing a cranial nerve assessment. So these are all things that should be taken into account. Athletes should be cleared by a physician to start a return to play. Some states say an athletic trainer can do it, and I agree an athletic trainer can. But especially when you're dealing with minors, I'd rather have that physician to fall back on to say, yes, this athlete is okay. Athletes should go through a graduated return to play. That starts with no activity, to low activity, and then back to full contact. So it's just, they're not just going back to full contact. Impact, just a little bit about Impact. Impact is a neurocognitive evaluation software available at a full price. All athletes should be baseline tested every 2 years. So what I do, once everybody's tested at the school, I test all freshmen and juniors every year, start of the year, and then aside from that, we'll test any new student. And then even if a new student comes in as a sophomore, they still get retested as a junior. All freshmen, all juniors, and new students. So it's kind of easy that way. Athletes should return to baseline via post-injury testing after injury prior to starting their return to play. So you have the baseline, and then you take a post-injury about 48 hours after. Even if you still have symptoms, you take it. Okay? You compare the two results. All right? Impact's really good. It's going to tell you, it's going to have red marks. There's going to be red. If you see red, that means they're not ready. And now, I mean, that's not that's not saying I know how to read Impact, but I've been to things where, they teach you about it, but, these are things that should be sent to doctors. There are, for about 4 hours of an athletic trainer's time, they could sit and be Impact certified on how to read it and be certified, and that's something that maybe they should be doing. So, and then I think the disclaimer here about Impact does not diagnose a concussion, or it's not also the end-all, be-all. It's just a tool, a very valuable tool. Put it in the toolbox, use it. Okay. Most colleges and professional leagues use Impact. Okay. Sorry, I forgot the E there. If you suspect a concussion, athlete is removed from activity. The athlete should be evaluated. You go over the history, what happened. 90% of a diagnosis comes out of the history. There's symptom checklist, the SCAT-3. The best is balance error scoring system. All right. Cranial nerves, upper quarter. Those are all evaluation techniques that should be used in some variation, for diagnosing a concussion. If athlete is determined to have a concussion, they are entered into the concussion protocol. All right, that's important. That is an important statement. If they are cleared and pass the slight exertional test, they should be allowed to return, but they should be educated. So that second sentence there is, that's if you suspect a concussion. You kind of go through this stuff, and they don't really have any symptoms. And then you give them that little exertional test, and if they're fine, they should be allowed to return, but they should be educated on that. So hey, these are the signs and symptoms of concussion. If you're out there and they start to crop up, you need to come off immediately. Okay, they're starting to try to take this second sentence here off the table in a lot of states, and I think that's probably for the best. The other statement down here is you must know your athletes, and that's important. You must know if they're trying to hide something from you, and be a good judge of character. And a lot of times, I pick up on that rather quickly, and then they're sitting. Management and clearance. So, we'll get in. I think one of the next slides here is going to get into the accommodations. Just so everybody knows. I know that's what a lot of you are waiting on. But management and clearance, athletes should fill out a daily symptom checklist. So from the date you have that concussion till you return, you should be filling out a symptom checklist, and that's also going to be attached. I think it has a St. John's logo on it. I couldn't find my digital copy of the one for the Wranglers, but it's the same thing. So you're scored each symptom a 0 to 6 scale, 6 most severe, 0 no symptom at all. I believe when someone has a 5 or below on this total on the symptom checklist, they can look to get a physician clearance. That being said, that 5 can't be on the headache. If they have a 5 on headache and they have a 0 on everything else, I would not be trying to send them to the physician for clearance. It is important to know, that their score should be a 0. The athlete takes the post-injury impact and returns to baseline. Okay, that's always good. The physician clears the athlete. These are all the steps. This is steps in order of how it should happen. Okay, so you send the baseline and the post-injury results with them to the physician to prove neurocognitively that they're okay. Okay, some physicians might not know what they're looking at, but at the end of the day, you've done everything you could. All right. The athlete begins their 5-step return to play. So that's going to be 15 minutes of light cardio, 30 minutes of light cardio is going to be step 2, 60 minutes is going to be step 3, light to no contact, but a full practice is going to be step 4, full practice is step 5, and then once they complete step 5, they can then look to go to the game. So the game could be step 6. There has to be a minimum of 24 hours between steps, and they must remain symptom-free. There are some states that are taking step 4 here and saying it's a full practice with no contact, and then automatically they're going to full contact. So if that's the case, I think if they're going to do a full no contact practice, the next day needs to be a full practice of light to minimal contact, and then then you add another step. Now we're on to 7 steps. Okay, and you know what? Sometimes I'd rather be safe than sorry. All right, and that's where we kind of get in. If you're not using some form of these steps, you should be, because this is what I would consider to be reasonably prudent. Same thing with impact. Impact is something that's reasonably prudent. So if you're not doing that and you have an incident at your school, and the administrators are up in that box and they're getting grilled by the prosecution and attorneys and stuff like that, or even in civil cases, if you're not reasonably prudent, you're negligent. And the thing about being reasonably prudent, it's not the decision that someone is going to decide on the decisions I'm making. So like, I made these decisions and I'm returning this athlete based on the knowledge I have at my hands, okay? But being reasonably prudent is somebody who can sit back and look at everything from start to finish and then decide. Well, the athlete dropped over during the middle of it. They returned too soon, got hit, and and now the athlete's in a coma. Well, that athletic trainer and that school are at fault. Well, you know what? But if that individual was in my same shoes at that same time, would they have made the same decision? No, because now they know the athlete's in a coma, or or worse, could be dead. So it's one of those things. Always be safe than sorry. Aspects to remember. School is exercise to the brain, so this kind of gets into the accommodations. So look to modify assignments and tests. So let's go back right here, and you can kind of pair up where the 5 steps are. You can kind of pair that up the same with homework. No athlete should attest to me in school, tests, quizzes, assessments of any kind. That's where return to a game scenario. That's a game for you in the classroom. Okay, once you're able to start your 5-step return to play, you should be able to start about 15 to 30 minutes of homework on that first day as a good rule of thumb. That second step, you're at that 30 to 45 minutes. Third step, you're at 60 minutes of homework. Okay. That fourth step, you would be normal homework and normal, things, but no assessments. All right. Step 5. Once they're on step 5, I believe that quizzes, and things should be fine. And then tests and papers and things would come in that where you return to a game scenario. And that's the best thing I can best advice I can kind of give. One thing that talking about concussions, and it has to be a team approach to it. So when I was at St. John's, I had Chris's support. It was great. We had the athletic director, president, all the guidance counselors, all the teachers supported all that. So what they would say is, I would send an email out. John Smith received a concussion last night. Should be held out of all assessments, and homework, should be excused from homework, till he clears, it's cleared by a physician and clears his baseline for concussion. And then, and his guidance counselor would support that. Everybody would support that because it was all in the best interest of the student. And the thing was, we didn't have students falling behind either, and we didn't have them scoring poorly on assessments, where it ruins their grades. Because they took a test they shouldn't have. And we also told the students this is not an excuse, to say, well, I'm bogged down when I return from a concussion. No, that is not an excuse. And, and the academic rigors of a private school are a little bit more of that of a public school. And the thing is, our kids seem to flourish because once they were good to go, on a lot of these assessments, they were good to go. They weren't, their symptoms weren't, being prolonged from being in a classroom setting. That was the other thing. All those students, they knew that if they started to get a concussion, or concussive symptoms rather, like the headache, the nausea, dizziness, any of them, they knew that they were allowed to come to the office, and then we would lay them down for 15 to 20 minutes to, in a dark room till their symptoms went away. Sometimes, you give them like some high protein food, give them a chocolate milk, something like that, something high in protein. And that usually helps to heal the brain as well a little bit faster. So when they're having those headaches, these are all good things to be doing, good practices that make your school stand out against any public school or any other private school for that matter. Here we go again. So when symptoms last over 21 days, it's time to refer the athlete to a neuropsychologist, because now we're getting into this, which is the next step of more of a post-concussion syndrome. That's what Sid Crosby had. All right, that's what Chris Pronger, that's another big-time name in hockey. All right, he's for the plays for the Philadelphia Flyers. He sat almost all of last year. He hasn't played at all this season. I had an athlete in a high school. He had concussive symptoms for 211 days on what wasn't even that bad of a hit. So that's why we kind of treat them all different and then send them there. Physical therapy can also help these individuals. It's just like you're rehabbing that ankle. There is a rehab protocol for concussions, and it's out there, and it's billable. So, if kids can afford to go to physical therapy for that, maybe they should. It's also better to be safe than sorry. Always err on that side of caution. Here we go again. Athletic department needs to be a team, and total school support is important. So, like, if an athletic trainer is saying this kid has a concussion, and then we should be, siding with the athletic trainer and supporting them. If the kid goes home and the parents say, no, they're fine, they can play, well, no. Until that parent shows me, like, their state medical license and their degrees, I don't think so. And then even if they do have them, I don't care, all right? Because at the end of the day, if something happens to their child, one, something happens to their child, and two, I'm out of a job. You know what I mean? That parent's not going to pay my paycheck. So, and then so could everybody else be out of a job because we might not have a school to come to. So these are all, that's why it needs to be a team approach. Where do we go from here? So the future is more research is always coming out on this. I probably get an email every couple days on it. Something new. Stay up on research. So have the athletic trainer stay up on research. Ask them, hey, have you heard anything new about concussions? Ask them. They should be keeping up on it as well. And we get publications all the time in the mail. The more we learn, the more we realize we didn't know. So, and I think that's kind of the scary part. So as much as we think we know now, in a year it could change. So, and every 2 years there's a huge concussion summit in Zurich, Switzerland. Okay, that goes over all the new stuff. So there was one just in 2012. So there should be one this year coming up in Zurich. Rule changes. You see this a lot, especially NFL, NHL. They're trying to take the violent hits out of the game, but that's why people are watching the games. But I think it's more, and the sad part is I don't think these rules are trickling down to high school as fast as they should. You're talking about like the horse collar. Horse collar tackling is still allowed in most high school football in most states. And the thing is, yeah, one, it breaks your legs, but two, when you're slammed down, you're whipping your head back, and that is the #1 mechanism of injury for a concussion. Not the actual horse collar itself, but the way the head jerks. And then the other thing is interpretation. In the NFL, your hand doesn't have to be in the pads for a horse collar, but high school, your hand has to be in the pads to even remotely get a shot at getting called the horse collar. To me, it's what happens to that person's body is where the call should be. So you could be splitting hairs there, but it's something that needs to happen. Why are concussions more prevalent? There's several studies out there about this. One of them it goes even far as to say, well, we now put children on their backs, okay, when they're infants. So the child is an infant, it's laying on its back. 20, 30 years ago, even when I was a child, we were put on our stomachs. All right, so you're put on your stomach, and you're forced to lift your head at an early age. And what they're saying is that builds all these intrinsic muscles in there that help to support the head, and then your it's a more of a inherent thing that this is the way it is because I've been supporting my head for so long. I also believe that they're more prevalent because we're better at knowing what a concussion is. We know how bad these adverse effects are. I said in the last one, like Muhammad Ali, I'm saying at least 95% chance he does not have Parkinson's. He has what they call CTE, which is a degenerative brain tissue. It's degenerative brain tissue from multiple repeated hits to the head. We know that Lou Gehrig did not even have Lou Gehrig's disease. Okay, he did not have the disease that it takes his namesake. Okay, it was from being hit in the head with fastballs. Okay, he got hit in the head, I think, documented 5 times by balls. This was before batting helmets. All right, it's kind of that whole punch-drunk syndrome that was labeled back in the 20s, I believe, first documentation. Someone called it punch-drunk. Where the old boxers getting hit in the head, where got the shakes, they would go crazy. You see even last year where a guy in the NFL, killed his girlfriend and then killed himself in the parking lot of their facility. There was a football athlete at Penn who, committed suicide. You see some of these other football players now, if you read the reports, they are that commit suicide, they're actually like shooting themselves in the chest instead of the head, so their brain can be evaluated for CTE. But the reason why they do this is they're just so out there. Their brain is just so deteriorated. They lose complete concept of reality. Like some of them can't write their names. Some of them can't function. They don't know like right from wrong. It's not good. They dissect the brain, and it's the brain of an 80-year-old. So I'm sure a lot of you have seen that on SportsCenter, the 360s, E60s, outside the lines. It's all over the place. I'd say keep up with the Joneses. If there's schools in your area who are doing all these things, do them. Or if you realize, nobody in our area is doing this, then try to be the first. Try to be the trendsetter. All right. There are stumbles along the way, but try to be the trendsetter, because at the end of the day, if you're keeping up with the norm or trying to exceed the national norm, chances are you're going to be safe and you're going to be at the forefront, and some of these legal issues aren't going to happen to your school. Encourage administrators to attend concussion summits with athletic trainers. So there's summits like this all over the country, where it's a whole day. They go into panelists and then ask your athletic trainer these questions. Try to have them explain things to you, and then learn together. and then take these concepts back to your school. Have a concussion protocol. That's the most important habit, that this is set. This is how it's going to happen. The reason being, when all else fails, you always fall back on the protocol. Always fall back. So if an athlete is 1 day away from potentially returning to a game, and they need to finish that one last step, but they haven't finished it, but it's homecoming and you're playing your arch rival and you're going to smash him and he wants to play, the answer is no, because there's a protocol. And you never, ever, ever stray from the protocol. Never let anyone override decisions made at the school. So, like, you make that decision, that's the decision. This athlete has a concussion, and they're going through the protocol. And you know what? If they don't like it, then they don't have to play. They don't have to be in athletics. So, and that's that's how it is. Everything goes back to their safety. Okay, and that's the other thing. An athlete gets a concussion in spring, they should complete their return to play. They say the school year is ending. They should be completing a return to play before they come back for the fall. So keep this documented and make sure that's happening. Okay? I mean, chances are if they don't, they're going to be fine, but I would rather have it documented they went through the return to play. We'll finish up with 2 scenarios. These are 2 that happened to me this year within the last month here in hockey, so we'll go through. So scenario 1, athlete was contacted by opposing player. The athlete comes immediately to the sidelines or to the bench. They state they feel out of it. You evaluate them for a concussion. No other signs or symptoms are really present. Okay, but is this a concussion? And the answer is yes. Okay, they came over, felt out of it, felt as if they were in a fog. They had all the feeling out of it questions. Everything was slowed down. Take them back about 30 minutes later after the injury. Okay, they start to have the full-blown headache, nausea, dizziness, sensitivity to light. It was all there. Okay, scenario 2. Okay, is athlete was contacted by a high stick to the zygomatic bone. Right, that's your cheekbone. There is a laceration requiring sutures. When screened for a concussion, the athlete complains of a headache in the area of the zygoma. So that's going to be the area like right around the cheekbone. So up into around the eye, down below. The athlete also has no feeling of any kind, and it was on the left upper side, on the left side of the upper half of his teeth. Okay, we're 3 weeks out, and he still has no feeling in his teeth. Okay. No signs and symptoms were present during exam or with exertional testing. Is this a concussion? And the answer here is no. All right, this was not a concussion. The headache was not actually a headache. His head hurt. Okay, his face hurt right there. You hit your head on a basketball court, your head is going to hurt. Okay, sometimes they don't have a concussion. Sometimes it's just I bruised my scalp here. Once it's into the brain and they have the whole headache, they have the whole thing going, it's a concussion. There on a side note, there's a study coming out of University of Michigan where they believe that sometimes even the concussions that we're diagnosing aren't concussions, that they're actually the hit triggers a migraine that goes through the brain. So we know that migraines start at the brainstem, I believe, and work themselves all the way up to the anterior portion of the brain, so right in the frontal lobe there. All right, so if they give you and put you in a specific MRI, you can actually see the wave of the migraine starting from the brainstem and going up, to the frontal lobe there. So, and they're trying to say that those aren't a concussion, but I'm in the corner saying, well, hold on, like they wouldn't have had this migraine triggered had they not been contacted. So the question is, what came first, the chicken or the egg here? And I think that's where I'm still going to sit those athletes until there's, proven research that I don't have to. So that actually concludes, everything. These are kind of a little bit of where we got, some of the stuff for the brief presentation. Pretty much general knowledge. But if there are any questions, you can surely ask them at this time.
it doesn't look like there's any questions. Thank you so much, Jeremy. That concludes today's concussion management for the secondary school webinar. We will be sending you an email in the next day or two with instructions on accessing the recorded webinar file as well as the presentation slides. We appreciate your time and invite you to visit our website at www.ncea.org to view the schedule of future webinar events. Thank you and good night.